Hi, everyone, and welcome to our very first Desire Wellness with nurse practitioner Deidre Arms. We're really excited to have her. She is the director of wellness for the Global PAD Association, and she is here. She's going to be doing a weekly series to offer ideas and insight and answer questions, your questions about anything pertaining to wellness. She is a top educator of wellness, and we're really excited to have her here today. Our first topic of discussion, and I think it's going to be a topic of discussion over and over and over again because we see it all the time and physicians do not talk about it, but it's the nutrient deficiencies resulting from medication. All medications have some sort of nutrient deficiency that is related to them. And if you know about them, you can end up asking your doctor about critical blood tests to ensure that you're not nutrient deficient or to see how nutrient deficient you are. It's really important because you need to make sure that you're in tip-top shape with the top levels of nutrients that you need. If you know about them, you can get supplements, you can eat food to help you get back to normal or as normal as you can be. So thank you so much, Deidre, for joining us. Really appreciate you. I wanted to start, though, if you don't mind, just a quick synopsis because you're not just a nurse practitioner, but you're also a cardiovascular patient as well.
Yes, I am. I had a dissection and open heart at the age of 46. And so my goal is to optimize, life and navigate that after open heart surgery. And I've been doing this through a functional medicine approach, looking at food as medicine and what can we do just to optimize our wellness. So that's kind of my passion.
That's fantastic. And it's really nice for people to know that, you're relatable. You can relate to them. You're on a lot of these medications, right? And you've had to do it yourself over time. And ultimately, for example, with my dad, he is on maximum blood thinners. And he was asking before this, he's like, oh, you mean that she can help me to understand that if I'm on Eliquis and I'm on Plavix, uh, what nutrient deficiencies I might be experiencing because he's having certain side effects that seem very weird, like muscle aches across the body. And so maybe those medications themselves are not directly causing the muscle and body aches, but it might be something that is resulting from those medications in some sort of nutrient deficiency that might be causing those types of side effects. So I'm excited to hear what you have to say, and I'll leave the floor to you to get started in this discussion.
Okay. Today, I just wanted to talk a little bit broad, and we can really get into this further. But some of the most common medications, as you know, with PAD and coronary artery disease is putting people on statin medications. Metformin is often used as well for the blood sugar regulation. And so there's a lot of known deficiencies with those, specifically CoQ10. Also your B12. And sometimes those deficiencies really become side effects. And if we know like what that actually does for us, the nutrient, how we can get it through our food, I think that is going to be really impactful in how we improve our health. So one of the top deficiencies that we see is your B12 deficiency. And I'm sure many of you have heard of B12. That's one that can be done in a serum lab. So you can draw, meaning a blood lab, you can get your blood drawn, check a B12 and folate. And B12 really plays an important role in your energy production, right? And it's from fats and proteins. It can help with our maintenance of our nerve cells, our DNA and our RNA. And so a lot of times people will feel that they're having like peripheral neuropathy pain, and it can be from a B12 deficiency as well. Not to say that the disease hasn't caused that, but we also need to look at the deficiency to kind of help. And so what causes B12 deficiency? All of our B vitamins are made in our basically microbiome, our gut. And low B12 can result from malabsorption, if acid reflux or problems with gastritis, if they've had anemia or H. pylori, the proton pump inhibitors that are often given to us, so that's your omeprazole, your Protonics, those can really cause B12 deficiencies as well. And oftentimes people who drink alcohol will have these deficiencies. So we're looking at like, what are the causes? The most common medication for that that's really widely published and known is your metformin. So most people end up on metformin if they have some sort of blood sugar dysregulation that is part of the disease process as well. And so the complications of a B12 deficiency can be anemia, fatigue, those neurologic like paresthesias, meaning numbness, tingling as well. Some people can have depression, even dementia. There's like some linkage between B12 and the 200s and 300s, like lower than that, causing some dementia type symptoms. So we really want to be mindful of that if cognition is involved, if you're having trouble with feeling numbness, tingling. And our food sources for B12 include like your shellfish, your red meats, your poultry, fish, eggs, milk, and cheese. So we really want to optimize that and improve B12 through what we intake. So that's the start of one very common deficiency that we see.
It's interesting. We see it all the time. And one of the things that we always recommend for patients is if they are feeling neuropathy, that they should get their B12 checked because it might not be absorbing properly. And also, we have found that so many people with vascular issues and cardiovascular issues have, as you know, what's called the MTHFR mutation. And when you have the MTHFR mutation, it's a genetic mutation. You're not able to turn your food into fuel, and the B vitamins, I understand, are not absorbing properly. So that causes an enzyme called the homocysteine to spike, and that's like nails on your artery walls. And so what you need to do, what we were told by our dietitian for both my dad and myself, because I have it as well, and I only discovered it because my small LDL particle number, I went and got the advanced lipid panel, and I would never have known that and never had the indication that I had that, except, this MTHFR, except for the fact that my small particle numbers, my LDLs, were pretty high, especially for my age, and without having any other risk factors for cardiovascular disease except for heredity, but that's usually in my family later on in life. And so we did a little further digging and found out I was having damage to my arteries because the homocysteine levels were up, my B vitamins were off, and my folate was off. I mean, it was just a mess. So I started taking a liposomal methylated B vitamin with folate, and that seemed to help bring it down. So I'm curious if you can talk about the differences in B vitamins that are out there, because some people think that just taking a general B vitamin off the shelf is going to be okay. But I was told that it needs to be methylated and it needs to be liposomal. And especially, every once in a while I go out for a little cocktail. So I was told that if you take one in a capsule and you have a glass of wine, let's say, or a martini, it's not going to be processed like in 24 hours. The B vitamins are not going to be able to absorb in your body.
So I'm glad you brought up MTHFR. So
Hmm.
MTHFR has basically there's 5 steps in how we process folate. And people who have an MTHFR, we call it a genetic SNP, so it's a gene mutation. And there are 2 copies that we're really looking at for this. One is the MTHFR 1298 A and the C677T. Those are the 2. And most of the time, you will look in your family, and these are inherited genes, but just because you have a gene, genetics loads the gun, your environment turns it, pulls the trigger. So we can turn on and off genes with our lifestyle. So I always like to, emphasize that what we do for ourselves can be really impactful in these genes. But what we usually see is family history of like depression, anxiety, cardiovascular, cholesterol issues. And so we kind of can tell without testing your whole family what side of the family that may be on. And so in that 5 processes of breaking down folate, there's trouble in doing that. And that is why when you take a methyl or a liposomal B vitamin, you basically skip this in between steps, so you get the byproduct of it, what you can absorb. I also want to say when you're eating foods that have fortified folate, you're not breaking those down too. And so that's your cereals and your breads and things like that. So folate's everywhere and fortified. And so we're getting it that way and our body's having trouble. And a lot of my patients have increased anxiety because of that as a result of the gene mutation there. And so methyl vitamins just helps you to process from step 1 to step 5 in the way that we process our B vitamins.
No, that's really important. And I also hear that you mentioned early on the medicines for acid reflux, and a lot of our patients are on those, especially because of their blood thinners, and there's a worry, from the doctors that they might get an ulcer or something, so they try to manage, I guess, the acid in the body. So when they put the patients, for example, my dad, on a high level of blood thinners, usually it's that cocktail of both the antiplatelets and the anticoagulants, they end up putting them on one of these, and that causes, I never knew, also vitamin B deficiencies.
It does. It causes a lot with absorption. And so that's why it's really important for us to be paying attention to nutrient deficiencies. We want to optimize. Obviously, when somebody's prescribed those medications, there's a real need for it. It's not something we just blindly give somebody. So if you're on that medicine, like you definitely have a need for it, right? And we do want to protect the gastric lining, but we also want to help with your absorption of nutrients and how to get that as well. So looking at what we can do to optimize.
So the top foods for those people that have trouble absorbing B, what would those be? Because are those vitamins getting into the body? Are they absorbing into the body without the additional supplement? Or is there another supplement that we need to take to help those B vitamins from our foods get absorbed in our bodies while on this medication that makes it tough for our body to absorb these
Exactly.
vitamins?
If you're already eating your red meats, your poultry, your fish, your eggs, cheese, shellfish, if that is part of your diet every day and you do a test for B12 and it's still low, I would definitely talk to your provider about how much supplementation that need. The range is pretty high for B, so I want to say that. So it's a water soluble vitamin, meaning like you pee it out. So if you've been taking B vitamins, you might notice that you have bright yellowish orange urine. That's okay. Your body's doing what it's supposed to. The range is about 290 to about 1200, depending on the lab. So that's a huge range of where your B12 can be. But optimally, if we can get from the middle to the high end of that, when you're on these medications, you're going to feel better and get the benefit of increased energy and decreased fatigue. It's going to help with the nerve pain as well that can be associated from the vitamin deficiency. And to talk a little further, your daily recommended for B12 is about 2.4 micrograms. And some people need an excess of 500 or more micrograms of that. So really you want to be looking at, what your numbers are and how to get to the most optimal.
Is there any concern for overdoing it with the B vitamins?
I would say if somebody has issues with their kidney and they're not like excreting and urinating, they would need a lower dose or a smaller the liposomal, sometimes liposomal just means it's rapidly absorbed, and that is usually either a spray liquid or it can be a sublingual as well, meaning under the tongue. You could do smaller doses in that.
Fantastic. And that's in because one of our studio audience, our live studio audience, Kim was asking the question about, taking too much B12. And so it's good. I mean, you can't overdo. There is, too much
Yeah.
of a good thing, right?
Right, and these vitamins are they're powerful things, so we're using them, but we also need to know, like you wouldn't take excess of a medication, right? You want to monitor these things and make sure that you're in the right range for you. And so test and then retest later, make sure you're doing good. Often tell people, if you have taken a B vitamin or you've gotten a shot, because some people do the methyl B, injections as well. Right after you take it, the level will be really high. So you want to take your blood test like at the lowest end, like before you take your next dose, before you do an injection, if you're injecting, things like that, because it's going to show it's high, like right after you've taken it.
That's a really good, I want you to reiterate that. If you
Okay.
are going to get a blood test to better understand your nutrients, I'm assuming that you should be off the supplements at least that morning. So if you're fasting, don't take those supplements. But how far back? What is a good range of not taking those supplements before you have a blood work? Is it 24 hours? Is it just 12 hours? What would your guidance be? Because you don't, those supplements are artificially, right,
Right.
boosting you want to know what's being actually absorbed in your body.
Right. So I would wait 24 hours after if you're taking it orally before you would get the vitamin test done, like a lab test. But if you're doing the injection, you need to wait probably 7 days because before you do your next injection, which most people are 7 days to 14 days, it just depends. But before you get your next injection, so you know your body's need for that still. I've had
And go ahead.
I've had somebody test right after doing an injection and it be in the 2000s, and that's going to happen. So timing is really important for when you're doing the test.
Hmm. And do you have any suggestions for people in improving their B absorption and their B levels if they are plant-based? They don't eat meat, they don't eat dairy, they're just completely plant-based.
So gets a little harder, right, with the antioxidant needs and knowing what that you need to be doing for plant-based, but with your B vitamins, because they're absorbed in the microbiome, so that means your gut. If you're having any GI symptoms, sometimes you're also not going to absorb as well. So that's always an indicator to me that maybe we need to look into the microbiome. But in your plant-based, you're looking at your, really rich green foods. Your spinaches. You can even use nuts for B vitamins as well. I always say, look at the diversity of the color of what you're eating. You're going to get more of what you need. Most people need 7 to 10 colors a day. 10 is optimal, and it doesn't have to be full servings, but you want to be eating the rainbow to kind of pull in the vitamins that you need. And so sometimes I challenge people. We all eat the same 25 things. If I challenged you to write down what you eat the next week, I guarantee it's over and over the same thing. So the next time you go to the store, pull in a different color that you haven't used of something. And even if you add a little bit of it a day, incorporate it into your food. But diversity is the best to get the B vitamins as well.
Ooh, I'm seeing a rainbow challenge here. It is Pride Month, and so rainbows are everywhere. So I think we expand the rainbow. And if
Yeah.
you get Skittles, you're in trouble. I do not want to see pictures of Skittles in our network. but I would get a good laugh out of it. But don't go buy Skittles. But I would love to do some sort of rainbow challenge and see, someone, show me your shopping cart. Show me your shopping cart. Show me the rainbow. I feel
Yeah,
like
let's,
what was the other one? Was it the Lucky Charms? Show me the rainbow.
yeah.
No, no Lucky Charms and no Skittles.
Yeah, and so diversity is great. Show us in your foods, like if you've made something and prepared something that has a lot of color. I love it when people like tag us and put that on our social medias and things
Yep.
because it encourages other people. Like they don't think about, oh, that looks easy to make. It looks really delicious, you know?
Taste the rainbow. Thank you, Josh, our YouTube producer. Taste the rainbow. I can
Yeah.
always count on him for correcting me with the right, slogans. He's awesome. Taste the rainbow. And I am going to challenge, actually, we have Bambi here. She's brand new to our network, and she has been showing us some amazing plant-based recipes on our site. So I'm guessing that she's going to be the first one to show us the rainbow, to taste the rainbow and show us her shopping cart and show us some great recipes. Challenge is on, Bambi. I see you out there. So I'm excited. Thank you for that. We're going to do this because Deidre is going to be with us every single week almost, right? And
Yes.
so maybe bring your rainbow, show us those pictures during our events, and maybe, what do you think, Deidre? Maybe we have your wonderful, talented daughter design a t-shirt for us. And so we pick a winner every week and we get them a t-shirt that
Oh,
has that they're the rainbow, they're the winner for the week with their shopping cart. That's what I'm thinking.
yeah,
I
that
love
sounds great.
That's great. I know. It's exciting. Okay, we're gonna have to think that out. I just derailed the entire conversation, but I'm excited about it.
Oh, be excited about eating the rainbow. It's actually the healthiest things we can do for ourselves is get that diversity. And actually the sequence in which you eat is really important too. So getting the rainbow in first, so the color, and then your protein, and then any carbs last. So for those people who struggle with blood sugar dysregulation, that will slow down the glucose spike. So getting that fiber, getting the nutrients in first, that's really important.
That's interesting. So the order in which you eat things, so you can have a full plate of, let's say, your carb, your protein, and your veggies. So if you eat your veggies, usually I take a little bite of everything, but if you eat it's interesting because over in Europe that some of them that people eat the salad first, right? You eat the salad first, even here in a lot of places. So eat your salad first, eat your veggies, then go after the protein, and then a few carbs.
Yes. And we do it a little backwards though in America. The rolls come out first. We have to say that.
Yeah.
We ask for that to come last. If you're eating, carbs and everything, ask them to bring it last to the table. But yeah, the fibers from the vegetables really will slow down any glucose spike. And so then you have the fiber that you need, the protein to sustain blood sugar, and then any carbs last. It doesn't mean that you can't enjoy life, but we can do it minimally. So.
And Bambi just wrote in. She says she got it. She's going to taste the rainbow. So I think that Bambi is going to be our first t-shirt winner. That's what I'm thinking once we
Yes.
design it, because she's like, game on. I'm going for it. She's already sitting there and she's typing in our chat. I just juiced beets. I love beets, but they taste like earth.
They do taste like earth. Every time I drink juice with beets, I think that, but like, I just love the way they taste, like when you bake them and everything. So, and those are great for cardiovascular health as beets.
It's interesting. So I'm hearing that Douglas is actually showing us a plate full of dishes. Douglas, do you want to show us your colorful platter that you got there? I can see you munching away. Show us your rainbow. What do you got going on? Unmute and tell us what you got in your plate there. I think this is fun. I love seeing what you guys got going on. I mean, this is a show about
Car-
nutrients.
Carrot,
Go ahead.
red grape, sliced red apples, sliced green apples, cucumbers, blueberry, and a banana.
Oh my gosh. So wait a minute. We got red, orange, yellow, green, blue. I think he hit the rainbow right there. Is he
I do
missing
too.
anything?
Um,
Nice job, Douglas. What's he missing?
Purple.
Purple, what do you got? Blueberries, I guess more they're blue, right?
Yeah. So if you're
What would be
getting
purple?
your blackberries look more purple, your
Okay.
eggplant, yeah. So
But that's awesome. Marcia, you have a question or some insight to share or a statement. Go ahead and unmute.
Yes, I noticed this fruit. I think one thing to keep in mind, though, is to be careful because if you have too much fruit, it's not, I mean, the fruit has a lot of sugar in it. So while fruit is good for you and you do want to have it, you also want to have appropriate portions. Is that right?
exactly. And eating it last because it can be a carb is good. So eating your vegetable fiber first in color,
Oh,
protein, and eating that last. Your berries are your lowest glycemic index of all the fruits.
so like right now, Douglas has, I don't know if he has full apples, but apple slices, banana, like how much of the different fruits, like what he's having right now would be good at one setting or per day?
So looking at that at one setting, the cucumbers, you could probably have an abundance of it. But if you're looking at like apples and your carrots and your banana, looking at a serving, so like maybe a half cup of those or just one apple. When you eat the skin of the apple, you're going to get more fiber, of course. Bananas have the highest glycemic index, so having those like half a banana or less, or just a few slices of that can be helpful, especially if somebody's really struggling with glucose in their blood sugars. So, but I am for like less processed food, even if you bring in the natural fruits and vegetables. So if we're going to pick something to do our best on, diversity in the food is probably a better thing to look after than ultra processed foods. So,
Right. It's hard because like when I first started this, I started eating lots of fruit and I quickly became pre-diabetic. So
yeah.
it's like, gosh, you can't win for trying.
Yeah, and so eating that last, if that's happening to you, so then do your fiber from your vegetables, then your protein, and then because fruits can be very high carbohydrate, you can do that last as your carb, and it will slow down any glucose spike.
Yeah, I was told with my dad that we actually measure out a handful of a variety of nuts that he has each day, and he when he has a cup full of blueberries, he'll have some walnuts that he's going to have eat a few bites of blueberries, then he'll have some walnuts or whatever kind of along with it. So what do you think about adding some nuts to that snack pack that he has? And also, Kim brought up a good point. The other, she's in our studio audience, that he had purple grapes. So maybe
Oh,
he did get the rainbow.
okay, I missed the purple.
Me
So
too. I did too. So
great job, Doug. Really great job.
yeah, it's almost as if he knew this was coming. He had that great intuition. But I think adding, what do you think about adding a hard-boiled egg, let's say, to that snack pack?
Oh, I think that's phenomenal to add egg and to get protein and even cottage cheese. And I've found, if people like scrambled eggs, to add scrambled eggs and cottage cheese together as you fry those because you're getting a higher protein intake there. So your protein's really important for the amino acids that you need in your well-being. And a lot of us fall deficient in protein because we need, anywhere from 80 to over 100 grams a day. And it can be difficult to get that kind of protein in. So,
Yeah, and for those with chronic kidney disease, definitely make sure you check with your doctor on how much protein is right for
exactly.
you, because it's definitely modified. But for everyone, we didn't do the disclaimer in the beginning. We usually do it in the end, but since we're here, make sure you do check with your own healthcare provider, ask for a referral to a dietitian or a nutritionist that can actually customize. They can look at your medical records and look at your blood work and customize a regimen that is right for you. So do not act on any information that you are hearing during these sessions without explicit consent from your own healthcare provider, your own healthcare team, and make sure you do ask for that referral to a nutritionist or dietitian. I know they're few and far between. They're really sought after. They're very busy, but every single insurance does have some coverage for a consult with a dietitian or a nutritionist. And that is really important that everyone who's listening goes ahead and does that, makes those appointments, because I think that they're the ones that are going to be able to customize a program for you.
Right. It's not a one size fits all for sure. So
No, go ahead.
making sure somebody knows your medical history. So
Mhm.
we're speaking in general, but you really want to make sure somebody knows your medical history.
And Bambi is bringing up the point. She hasn't seen an egg for about 5 years. She is completely, I think, vegan. She is concerned about eggs and cholesterol. They said eggs have a lot of cholesterol. And, it's interesting. There have been studies, it's so back and forth on that. Does the food cause the cholesterol, or is it, the damage to the arteries from other things that literally cause the extra production of cholesterol, or the the cholesterol going in and in a sense, getting into trouble, especially those small LDL particles that can eke into those damaged areas of the arteries and push that wall out, creating those hardened arteries. What is your take on eggs and food in general as raising cholesterol?
So most of the time it's the inflammation, and there can be that genetic predisposition of it. Most of the time people can eat an egg safely. It doesn't have to be every day. We do need some cholesterol for brain health as well. So it is important for that. But when you have cardiovascular disease, peripheral arterial, your need to keep cholesterol lower depending on what your NMR labs look like Kim was saying with the particle size. That's how you customize that. For some people, eggs can be inflammatory. They can cause headaches. So there are some issues with eggs for some people.
And Marcia, you have another question or insight?
Back to the fruit. So at night, I usually have a little dish of mixed fruit every night, mixed with cottage cheese. Is that a bad thing to do to have at night? Or I might have popcorn, to be honest with you. But is that a bad thing to do? Like you said, to have it after your carbs and that, but like before bed, I guess. Is that bad?
So let's back up here. Usually eating on your circadian rhythm is the best for you. So when you say before bed, it depends on what time bedtime is.
I'm an intermittent faster also. So I don't eat anything till dinner. So I eat like between actually like 6 and 9.
Okay.
At midnight, to answer your question, is when I go to bed.
Okay. So wouldn't be bad. No, I don't think it would cause a huge glucose spike if you are eating it several hours before bed. It's when we eat, like we break a fast or we eat in the middle of the night, it raises our cortisol level too. So that can be an issue. Looking at cortisol or stress hormones, and that can cause inflammation in the body. So when people talk about intermittent fasting, I just say we should, get up with the sun, go to sleep with the darkness. We should also eat, on that too, not eating late when it's dark and things like that, because that will raise cortisol as well. So a little of that as your snack before bedtime. It seems like you have good protein in that as well. And so the protein can sustain you through the evening. And it also matters if your blood sugar is dropping at nighttime too, to get that protein as well.
Does that answer your question, Marcia? I'm guessing that she either
Yes,
dropped off.
yes.
There you are.
No, I just muted myself again. Thank you.
Welcome.
And I know, Deidre, I am curious, is popcorn okay? You know what I do to justify my popcorn is I get some of that special olive oil from Amphora Nueva that is hand-picked, cold-pressed,
Tony.
on and on and on. Healthiest extra virgin olive oil on the planet. It's been voted 3 years in a row as the healthiest olive oil in the world. And I get that specially and I drizzle it on top of my popcorn thinking I can justify my popcorn.
Yeah, and so for some people, popcorn is okay. For other people, it does a huge glucose spike for them, even into the morning. If you want to know what your glucose is doing, pretty soon here, the continuous glucose monitor will be on the market, that you can just purchase one and wear it. And that's how you can really know what it's doing to your body, if it's raising glucose or not. But for some people, popcorn is a great snack. And for others, I cannot eat popcorn without causing issues with my blood sugar. So
That is really good to know. That is very good to know. I think I'm going to, instead of that, I'm going to turn to my dad's little bag of nuts, his snack. And you know what we do to flavor? And we get the completely raw, nuts. We get walnuts, we get almonds, we get cashews. And I put in a natural dried wasabi peas, not the ones that have the artificial. I know it's so hard to find the ones that don't have the artificial color in them, but we have been able to find ones that don't have artificial color in them, and they're just dried peas, dipped in some, dried wasabi, just the powder. And we shake it up in the bag and just adds a little bit of spice and flavor to our bag o' nuts.
yeah, and that's what you do. You can add lots of spices to not have increase in sodium and things like that, and to get more flavor in what you're doing, even your vegetables.
Yes, yes. So that's really good. Okay, so we've exhausted everything on the vitamin B, at least for right now. What is the next one that we can talk about in terms of the medication deficiency, the nutrient deficiencies caused by some of the medications that are standard for treating vascular and cardiovascular diseases?
So let's talk about like your statin medications for your cholesterol, because the biggest thing there is your CoQ10. And so you may have heard about this. And the function of CoQ10, it's a powerful antioxidant, right? And it's synthesized in the body and contained in your cell membranes there. And it's also essential for your energy production and pH regulation. And so what causes the deficiencies, can be the medications. It's well documented that CoQ10 is a deficiency in statin medications as well. So a lot of times when you're getting put on that medication, you're also being told to supplement with CoQ10. The deficiencies can also occur, on anti-diabetic medications as well. So that's your sulfonylureas and beta blockers can also. So you're looking at, that's probably the biggest one for what many people are on who have PAD and coronary artery. Low levels of this can basically aggravate oxidative stress. It can cause diabetes, cancers, congestive heart failure, arrhythmias. You can notice it in the mouth, so gingivitis, and some neurologic conditions as well. And so when we look at CoQ10, your main food sources, again, are the meats and poultries and fish. Your soybean can be that. Nuts and whole grains can also have really good CoQ10 in them as well. You can get moderate sources of CoQ10 through fruits and vegetables, eggs and dairy. So it's a really important piece to that. You can do a serum lab draw and look at CoQ10 numbers as well. But I will say, if on any of those medications, you're probably getting a deficiency in it, even with food. So
it's interesting because I didn't know that you could measure CoQ10 levels until my dad and my mom ended up going and getting advanced blood work through their functional medicine practitioner. Is CoQ10, as far as you know, um, available under insurance for most people? Is this something that
So
standard? Can people request it?
a lot of times with like a diagnosis of peripheral arterial, coronary artery, hypercholesterolemia, you can do some of these specific testing. It's really hard to know what insurances will and won't pay for, but you can always call ahead of time to your insurance and just question, if I'm in network at a lab, how is this covered? There's always the big thing about deductibles too, like have you met a deductible? And so that kind of plays into what the cost of things are for many people. Boston Heart is a lab that does this whole, yeah, they do a whole panel for cardiovascular. I really like that lab. It's very comprehensive. They'll do homocysteine. So I've done CoQ10 levels and homocysteine levels on many of my patients without them having to pay extra. You know, it kind of fell in their routine, what their labs were covered. So
I love that you mentioned Boston Heart Diagnostics here in the US. That's exactly the blood work that both my mom and my dad went through, and they send you an actual full booklet that literally paints the picture of exactly what every single result means. And they do it in layman's terms, which is amazing. And that's what makes me so just concerned that there are doctors out there that will refuse to do Boston Heart Diagnostics and won't sign on, even though it's free for doctors to sign on to offer Boston Heart Diagnostics lab work, which is the most advanced blood work I think that you can get for cardiovascular diseases and vascular diseases. It's really comprehensive, and Medicare covered it for my dad with a copay. So that was pretty amazing. And they have special labs that actually offer it. But the doctor actually, one of the doctors said to my dad, no, we can't offer it any longer at our hospital because the doctors don't know how to read the results or what they mean. That's disconcerting to me, that here is advanced blood work that is available and doctors are not taking the time to learn more about what this blood work potentially means. They're just waiting for this grander evidence to come out about that. But why don't these doctors become a part of the process, a part of the journey, a part of practicing medicine to help advance the understanding of the results of this blood work, this newer blood work, this more comprehensive blood work, so that they can offer it to the patients and customize medicine and customize the supplementation along with this medicine.
exactly. Boston Heart, the way they present it to you as the patient and what you get out of that is so powerful, because when you get your routine labs, you're just told if they're normal or if they're abnormal, right? You get a little bit of that, but it in detail tells what's going on. If you can find a provider that does that, phenomenal. You know, have it done at least once, know your body really well. But we're getting a trend towards more personalized medicine. We are, but we're not there yet. You're right. There's a huge gap in what we should be doing and what we are doing. So,
And you're in Ohio, and you're
yes.
in the Columbus area of Ohio, in the surrounding area, right? What's your town?
So Columbus and Lancaster are where we have two of our clinics.
Oh, fantastic. And that's Desire Wellness. And we have the website desirewellness.com.
Yes,
And for those in Ohio, you offer that comprehensive blood work. You're able to order that for folks that qualify.
we are. Yeah. And most of your functional medicine providers are well equipped, but I think Boston Heart even will help you find a provider that does their
They
stuff
do.
in your area. So,
If you go to their website, they definitely will help you find a provider in your area. And there are more providers actually that do offer it than you realize. You just have to make sure that they are covered by your insurance as well. But I can tell you that, and I'm not gonna, they're not paying me or anything, but I can tell you just from experience how comprehensive it is and the impact that it has had our family and our ability with my dad and when my mom was here, what we were able to do to customize the supplementation as well as diet. And what's great about what they offer is for everyone that gets their blood work through them is they will give you it's like 10 to 20 pages of dietary suggestions. So if you go to them after you've gotten your blood work, you've gotten the results, and you apply for there and say, hey, I want a consult, they'll give you one free consult with a dietitian or a nutritionist to actually help you create a plan that then you can work with your own dietitian or your own nutritionist to make sure to customize it or to maintain a program that's right for you for long term. So it's pretty cool. It's a great. I'm so glad. No wonder. I'm so glad you're a director of wellness because you're very advanced. I love it. I love it. Okay. So we got in CoQ10, we got in B12 out of the way, we got in CoQ10 out of the way. And I do think it's really important because a lot of doctors will just tell you, and you see the commercials, if you're on a statin, take CoQ10. But I think it's important for you to know your CoQ10 levels so that you can make sure to customize the exact amount that's right for your situation. And we always suggest, I'm curious on your part, that we do have there should be a specific every 6 months when you're on all these medications to do this blood work, to have a consult with your doctor, just specifically to talk about the medications and talk about potential deficiencies in your diet. And I'm curious what your algorithm is for that.
So that is what I do. We do routine labs. We make sure that what we're doing is improving things. When we get people who, like, if they have a need for medication, there are some other like advanced testing that we do that does micronutrients and looks at your amino acids and things like that to make sure we're getting exactly what we need in the diet, try to help us figure out what's best for somebody as well. I would say just really, a multivitamin isn't always the best thing for you if it's not a well-absorbed multivitamin. So sometimes we just blanket statement, you need a multi, but why do you need it? What are the reasons? And a nutritionist or dietitian, I can't say enough about how impactful that is for people. And I feel like everybody should at least see one a few times in their life.
Yeah, no, 1 or 2 times. That's awesome. I always, if your insurance covers it, maximize it, maximize it, maximize it.
Do whatever you can. Yeah.
We do have Marcia Burr, on. She has a question for you as well. Marcia, do you want to go ahead and unmute and ask the question yourself for nurse practitioner Deidre Arms?
Hi, Deidre.
Hey.
I'm curious. I've lost, to me, a significant amount of weight in the past 6 months, year. Like in the past year, I've lost 20 pounds. In the past 6 months, I've lost 10 pounds. And I'm thin to begin with. So I take several drugs related to my PAD. I don't have diabetes, but I do take gabapentin. I take an injectable Repatha for cholesterol. I take the highest dose of Crestor. And I take baby aspirin. And one other thing that I put in the comments. But I'm wondering, do any of these drugs have an effect on your appetite? Or
Like suppression of appetite? Let me see here.
yeah, because I'm just not hungry.
Okay. And so that's why you're losing the weight, is suppression of the appetite?
Yeah. It's like, I don't want to eat. I'm not hungry.
My thought right off.
I mean, I do eat, but I'm just curious because I've lost, to me, a significant amount of weight.
Okay.
And I will say that my right leg, because I'm at stage 3 PAD, critical limb ischemia, and my right leg and calf is significantly, noticeably thinner than my left.
Okay. So the gabapentin typically can stimulate appetite. Like, look, it could be the combo of things too. Let me look here at your.
What they want to say, but and I told him at one point, I want people to get to know you.
Hi, Lisa. Lisa is there. Lisa just got done with a walk while you're working with Marcia Burr on that. I want to say hi to Lisa. Lisa, you got out there on your walk this morning. I saw you out there walking as you're joining the discussion. It looks like you're feeling pretty good. We appreciate you joining us.
The
I'm
crust.
doing good, but boy, is it hot in Texas.
Yes. Yes. And so you probably want to know how to improve those electrolytes and make sure you're hydrated enough to get out there and walk and withstand the heat and make sure that you're not going to lose some other very important nutrients.
Yeah, I take some electrolytes that I have from when I used to do a low carb diet that you mixed in your water.
Oh, that's good. We have to make sure though, if there's maybe Deidre will ultimately have some suggestions on some low sugar electrolytes that you can get in, maybe ways in which you can do that naturally with some other things. And we'll get to that in just a moment. She has some suggestions for Marcia Burr. You're ready to share your thoughts on that.
So, looking at your meds, I was trying to like look at all of them. I think it's the Crestor. So you probably would want to talk to your whoever's prescribing that, because it could be causing the loss of appetite, could be making you tired or weak as well. With several of the medications, I just looked here. The deficiencies that go along with yours would be CoQ10, the B12 as well, and folate, and then selenium is another one that is related to the Crestor specifically. So,
How about the Eliquis? That was the one I forgot. Eliquis.
Eliquis here. Do a little search here. I don't see where Eliquis, I'm looking for the weight loss. Was that the last one that you?
Yeah, that was the one that I couldn't remember.
Yeah, it is a side effect, decreased appetite as well. So you've got two medications causing a decrease in appetite. So maybe talking to them and giving those symptoms, and they're obviously seeing that you've lost weight because they should be taking your, vitals and getting your weight. But if you're having like such a huge loss of appetite, having a discussion about those, and also if you're able to get in adequate protein, might be something you need to be focusing on for you specifically, so that you have increased energy and you're not losing more weight and becoming underweight from the medications.
Right.
You're
so
making
you
sure
think
you
I should do a
maximize when you're
B12?
eating.
You think I should
Making
do a B12 test?
Yeah, I would ask them to do B12, and if they'll do CoQ10, that's another one. So you can do B12 and folate together, and even the selenium.
Great. Well, thank you so much. I appreciate it. Because I wasn't worried, but I was noticing. I was like, I wonder why. So
Yeah.
I have some answers.
Yeah, and so when your meds cause a suppression of appetite like that, always talk to your provider and see if there can be changes or a reduced dose for the same efficacy that they need to optimize your health.
And making sure,
Right.
is there any way that she can maximize, so when she does eat, any way that she can maximize those calories, maximize that protein without causing also those blood sugar spikes, but making sure that when she does eat, she's getting and it's not often that I say this, but getting, more calories and more nutrients in, to pack a punch in those few times that she does want to sit down and eat.
Yes, and that's why the protein is going to be important for how she's feeling. So see how much that they, depending on your disease state, how much you can have of the protein, and optimize that first. That's going to cause satiety. It's not going to have as much of the glucose ups and downs with protein, but it will also help to maintain your weight.
Great, thanks.
Thank you so much for that, and thank you, Marcia, for jumping in. And back to Lisa. Lisa, it's really hot. It's summer. We're telling everyone to get out and walk, walk, walk. Make sure to protect themselves. Wear the sunscreen. But when they're out there walking, they're obviously losing a lot of electrolytes and a lot of other nutrients. What is your suggestion for getting those back, and maybe things that they can do before they go on their walks, after their walks, but also considering, a lot of our patients are diabetic or pre-diabetic, how to do that without spiking their blood sugar?
Right. So your walks early in the morning or later in the evening, not in the middle of the day where the sun is probably best for many people during this hot summer. If you do not have sodium restrictions, you can do a little Celtic salt, a pinch of it in your water. It helps pull the water into the cell. So you want to hydrate before, make sure you have something with you on your walk. If you are feeling a little flushed and from the heat, it's okay to sit down, like take a break, get some more fluids in it, because when we become dehydrated, that heart pumps harder and we feel it in our chest. So we really want to hydrate well during all the time, but during the summer.
Yeah, all the time.
Yeah.
Especially. And we always hear to hydrate, 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 but most of us don't get enough water. Also with chronic kidney disease patients or ESRD patients, make sure you do check with your doctor on not only, and this is really important, not only what you should be, taking in the parameters around your levels of liquid you should be taking in, but then also if you're out there walking, you need to mention to these doctors, your nephrologist, hey, I'm going out and I'm getting extra exercise in. When I'm getting that extra exercise in, then how do those levels of hydration change? How much water or liquid should I be taking in when I'm also exercising for 30 minutes? And especially even more, I'm going to take it to the next level, also in the heat, because that can really cause huge swings in the hydration in your body.
You can get dehydrated very quickly in the summer months. So looking at the coolest time of the day to be out and walking. So yeah, move the body, walk in the malls if you have to, go to a big grocery store, walk around it. I see a lot of walking groups in our malls and things where people are indoors staying cool, but they're still moving. So
I tell everyone, if you have a Walmart near you, walk in Walmart. Walmart is huge. And they also have Target superstores now, huge superstores. Walk in those. Also, what's really, really fun for me is a Home Depot, because then I'm not actually enticed by the food, and they have really wide aisles to walk in. So you're not really bothering anyone when you're walking in one of those big, Home Depots or Lowe's, type of superstores. Because you can just walk around the aisles and walk briskly, and you're not interfering with people checking out the light bulbs and screws.
yeah, and many of the YMCAs and places will allow, if you have Medicare, like discounted or free memberships. So that's another place if there's a track around you. Outdoors, I love to be outdoors, so I'm all for if you can be outdoors, be outdoors. But in the summer, you really gotta, I even know for me when it hit 90 last week, like I had to do stuff really early in the morning or much later at night. And even water walking can be really impactful. So if you have access to a pool, water walking, just getting the lymph moving.
And, speaking of the summer and sunshine, vitamin D, I think that is a really important one. A vitamin D deficiency, it can cause so many different issues in your body. And I'm curious if any one of the medications, whether it's the blood thinners, the statins, the metformins of the world, if any of those can also exacerbate any sort of vitamin D deficiency.
I think absorption, so anything that's messing with the gut can. I know because we live north of the Mason-Dixon line, everybody in our area is deficient anyways. So we get it primarily from sunshine, and yet we tell ourselves like we put sunscreen on when we go out. So if you can get outside for 15 minutes, first thing in the morning without putting sunscreen on, you're going to get some vitamin D that way. Most people, so the optimal range, especially I want to say for female and bone health, is around 50 to 80. And I know a lot of times they'll say 30 is normal, but your need for it's higher. I can't think off the top of my head a specific medication that causes a depletion of that. So if we have any you want me to look at, I'm happy to do that.
No, it's interesting because I think so many of us are vitamin D deficient. Just as you said, overall, we were just in the Northwest and I met with a nurse up there and she was saying that pretty much everyone who comes into her practice is vitamin D deficient. And she was saying that it causes so many problems and they have to work extra hard up there for that. And especially with vascular and cardiovascular patients, because so many of them are told not to take a K2 MK7 along with it to help with absorption. And I was even told that I shouldn't, because I had a reaction to the COVID vaccine, that they told me that I shouldn't have the K2 at all in my diet. But I ultimately went back and I found out my blood was fine and I could go back to do my D3 K2 MK7. Do you
Yeah.
have any advice around those types of combinations, especially for cardiovascular and vascular patients, to make sure that the vitamin D is getting absorbed? Can it be absorbed efficiently alone? Or does it need something else to help it better absorb in your body? And what does that
So
mean?
K2 really does help absorb vitamin D. I do have patients though that just take vitamin D and they get good absorption. This is why it's important to draw the levels with whatever you're taking, because I've had people come in and have still the same low level but had been supplementing on something. So knowing what's right for you and what we can do. I prefer the K2. I prefer that if you're able to use the vitamin D with K2, just so you get absorption on less vitamin D.
And does it do anything with the MK7? I don't even know what that is. I was just my younger brother is really, he's a great researcher and he told me, he's like, no, make sure you get the D3 K2 MK7. And I said, what is MK7? He said, just take it. My brother's not a doctor, but good researcher. I should check with my functional medicine practitioner on that, but if you have any insight, that would be interesting.
Yeah, give me a quick second here and I can tell you a little bit about it, because we use the, so
I'm curious, one of our studio audience was asking, I didn't know there was a K12 vitamin D. Is it, are you sure, Bambi, that it's a K12? But her GP took her off vitamin D. Well, it's worth, Bambi, asking your physician for blood work to ensure what your vitamin D levels are, and they may have taken you off the vitamin D because of your levels might have been high. It's worth checking as to why they took you off the vitamin D. There is a school of thought that some believe that vitamin D can lead to atherosclerosis. I'm not sure, Deidre, if that's something that you're aware of. My functional medicine practitioner calls it hogwash. She doesn't think there's any direct causal relationship between D vitamins and leading to atherosclerosis. She's more on the comes from the school of thought that there's inflammation in the arteries, there's damage to the arteries, and that's what leads to the atherosclerosis. She doesn't think vitamin D levels have anything to do with that in terms of too much vitamin D, but just curious your thoughts.
I am all for vitamin D. There's always been a lot of controversy back and forth of people saying you don't need it, you do need it, but it's a powerful antioxidant that our body does need for so many processes in the body. And so when you couple it with the K, you get the, better absorption, right? It's a fat soluble compound. But it is helpful not just for your bones, but cardiovascular health in general, which a lot of the studies like the National Institute of Health and CBI, like you can pull articles from those and see that it's important. And then the MK7 actually has to do with the K2 and basically making it more absorbable. So.
Is there any benefit to taking K2 on its own if your vitamin D levels are high and you can't take vitamin D? Any benefit to just taking a K2?
If your vitamin D is high, my thought is you don't need the K2 because it's absorbing, it's working. So
It's working.
that's working really well.
That's awesome. Is there any downside to high vitamin D levels? Just don't take the vitamin. Is that a good thing or does it matter?
Yeah, you would, if you were in excess of 100, you would want to back off from that because it is a fat soluble vitamin. I've only seen one person supplement so much they got above 100 and we just back them down, keep them in that range. 50 to 80 is a sweet spot, I always say, where you're going to get the bone health, the cardiovascular, decrease in inflammation from the cells. And if you have a lot of joint pain, that's something to really think about is vitamin D supplementation.
That's interesting. And I'm curious, we have Kim who wants to go back to the CoQ10. She's asking, should you get the ubiquinol version?
Oh, yes, good question. So I personally use the ubiquinol CoQ10. What do you know about that, Kim?
That's I don't know if she can unmute.
Okay.
Kim, can you unmute? She has sometimes when she attends, she has some trouble with audio.
Okay.
So
I was just told
there
that
she is.
basically it absorbed better.
Mm-hmm. Yeah. And it's very helpful for improving heart health, blood sugars, and managing blood pressure, and people with diabetes. So it's just a better absorbable form of it, which sometimes can be hard to find in just the regular world of things. What's the best absorbable? You walk into a store and you see all the supplements and it's like, where'd I go from here? So sometimes you can ask a pharmacist for their help. I had a patient recently go up to the pharmacist and say, show me which magnesium. And she was like, not good, okay, best to the patient. So getting some guidance on that. But yes, the ubiquinol is a better absorbed.
And Kim, you also had another question about inflammation. Do you want to go ahead and ask your question?
Can you recommend any supplements or vitamins that help with inflammation in the body?
I think everybody should eat turmeric and ginger in their diet. Those really decrease inflammation. Turmeric's the most studied herb out there, but if you're on a blood thinner such as Eliquis, and then anyways, that one can thin the blood more. So there's a fine line of that one, what they say, but eating it is a good way to absorb it. Ginger is great. Your omegas, so anything omega-3, fish oil, eating like your salmon, your omega-3 rich foods. We get a lot of omega-6 rich foods in the US because that's more in our diet than getting, the omega-3s from fish and things. So
Cool.
Can I just comment? I was just told that I couldn't do turmeric because I'm on blood thinner Xarelto, right?
Yeah.
And to stop taking my fish oil supplements as well, right?
Yeah,
That's always frustrating.
Ginger is going to be a good one for you. Like if you can, I usually juice ginger is what I do. I put it in lemon, and apple, a little bit of carrot. Like I do a carrot, a lemon, an apple, and I do ginger, and then you're getting anti-inflammatory properties.
Okay, I hate ginger, but okay, thank you for the answer.
You can do
Sorry to be the bearer of
capsules.
bad news.
You can do some capsules, and that's not near as bad.
Yeah,
Okay.
my dad was told by his functional medicine practitioner to get raw ginger capsules, and you can ask your healthcare provider about those, but um, he uses the raw ginger capsules,
Yeah.
and that's how he's able to get his. So I hope
Thank
that
you.
helps. Um, Deidre, I know we've taken so much of your time. I know you've had so many more vitamin deficiencies that you wanted to go over. So what do you say next week? We just say to be continued, and we take on those additional vitamin deficiencies caused by standard medications to treat cardiovascular and vascular diseases, and we just continue next Wednesday. What do you think?
I think that's great. And if anybody has specific ones they want me to like talk about, if you let us know ahead of time, that would be great. Then I
Yes, go
can.
ahead and submit your questions. You can go ahead and you can email kym@thewaytomyheart.org. We'll also, I think, Deidre, we should create a page for you on our website so people can submit their questions directly there as well. And we can have them forwarded to you so you're all ready and set to go
Okay.
each week. And you know what topics people are most interested in hearing about. But we're going to be live here. The time may vary. Deidre is a practicing nurse practitioner with Desire Wellness in Ohio, and she's also the director of our entire wellness program for the Global PAD Association. So she's quite busy. So the time might be flexible each week, but I think for the most part, we're looking at 4:30 Eastern time. I think it is that we're going to be doing this. 1:30 Pacific time, 3:30 Central time, 2:30 Mountain time. And that would be, I think, 8:30 or 9:30 London time over in England. So we have people all over the world that are here. But it is 4:30 Eastern time that you're looking at as being kind of a standard
Yes.
weekly. Okay. So, plan to tune in, make sure that if you are within our network and you want to join via Zoom, you look at our events calendar in every single group, and we'll make sure that we post the link each week. This link, if you do have it, is going to be, I think, consistent every week for this particular event. And you have that. Also, if you prefer to just join via YouTube and join passively, definitely go to our YouTube channel. And if you subscribe to our YouTube channel, you're going to get notified when we add new events to our calendar. So you will never miss an opportunity to ask your questions, because on YouTube, you can also write in comments. And we have our amazing YouTube producer, Joshua, who is there fielding those questions and making sure they get to us. So you will be heard. You will get your questions answered by nurse practitioner Deidre Arms with Desire Wellness, desirewellness.com. If you want more information, if you are in Ohio, you can make sure. Do you take insurance, or are you purely a private practice?
We are a non-insurance based practice. We try to order things that insurance will cover, but this way we can see everybody.
Yeah, no, yeah, you want to democratize access for the most part. But also, if you're ordering tests or ordering, medications, things like that, those are definitely ones that you can get covered through your practice, and you'll work with the patient beyond the consult fee, right? To make sure that you're keeping down those costs.
Yeah.
Fantastic. Thank you so much, Deidre, for joining. Do you have any closing thoughts for everyone? We have quite a few people that are on here. I also just want to make sure we've answered at least the questions for those that are on here. If anyone has any final thoughts before we jump off, but it sounds like you've covered so much. And since we're going to be meeting again next week, if people have further questions, go ahead and email me, and we'll definitely prepare those for next week when
Yeah.
you come back on.
We want to make this as impactful for you as can be. So, and
Definitely.
let's do
Thank you.
this rainbow challenge.
I love the rainbow challenge. So next week, what do you say? If anyone presents either on YouTube You can comment on this YouTube video between now and next week with a picture or a comment. Whoops, I'm going to lose my light here. You can actually go on, sorry about that. It's, you know, I'm in California, have little earthquakes, right? Or even artificial ones. I have a dog that's going by and knocking my light over. Okay, back to the point here. Dogs derail conversations. Rainbow challenge, the rainbow challenge. Post that picture of your shopping cart or of your plate that represents the entire rainbow of foods that you should be eating to get all the nutrients that you can. Show us the shopping cart of what you're buying. Show us your plate of what you're eating. Show me the rainbow. Taste the rainbow. Post that picture either in YouTube and comments, we'll be looking for that, or go ahead, post it in our network of groups. If you're not in our groups, you can go to PAD support. I think it's PAD, and maybe if Douglas is still here, he can help me. I think it's padsupportgroup.com or .org. And you can join our groups. Go ahead and post in our groups that picture of the shopping cart or what's on your plate. And Deidre, I'm going to put you on the spot. Deidre is going to be choosing a winner each week for either a t-shirt or some sort of Global PAD Association rainbow swag saying you're showing the rainbow. And you're going to talk to your doctor about helping us with a design.
I will.
Fantastic. Thank you so much, everyone, for joining us. Thank you, Deidre, for your time. We really appreciate you for helping us and providing your insight.
Yes, thank